The greatest enemy to this work is the status quo. Healthcare is incredibly good at protecting its own inertia.
What you're in now is our neonatal intensive care unit.
Martin Luther King has this line in the letter from Birmingham jail where he says, "In our generation, we will repent not for the vitriolic acts and words of the bad people, but for the appalling silence of the good people." And that's the challenge in healthcare right now. How do we break the silence around what our healthcare system has become and recognize what it was always meant to be, which was about delivering health for patients across the country?
Hi. Good, how are you?
Sunshine. So now you get to see Dr. Levitt today.
One of the powerful things is that doctors, for the most part, truly know what their patients need, but we've just designed a healthcare delivery system that is not built to recognize what is known and understood to drive health outcomes.
Can you give me a nice deep breath in and out through your mouth?
So it's well documented that just 10% of health outcomes are attributable to clinical care, but almost 70% are tied to social and environmental factors and the behaviors that are associated with them, essentially everything that happens in a patient's life outside the four walls of the clinic. When we think about asthma, for example, so many patients struggle with asthma because they're living with 12 other people in a dilapidated brownstone with asbestos and mildew. And that's just not the conversation we have in the healthcare system. We have a conversation around using your inhaler, taking your controller medication. But the truth is that until that family actually finds different housing, that kid's gonna be an asthmatic.
Some of what keeps us healthy is going to the doctor, right?
Right.
And we get our medications and they have a bunch of specialists that they're seeing. But most of what makes us healthy happens in our house or in our neighborhood, right? Like, what foods are we eating? Do we have
My neighborhood grocery store is horrible.
Your neighborhood grocery store is horrible?
Yes.
Tell me about that.
It's horrible.
HealthAid's vision is of a healthcare system that addresses all patients' basic resource needs as a standard part of quality care.
So did you need any furniture or household appliances, anything like that? Or was it just mainly clothes and diapers?
The health systems that we work with, the goal is that every time a patient comes into the doctor, they're asked about food and housing and heat the same way they are any other clinical vital signs. Blood pressure, height, weight, is there enough food at home? That's how you make good clinical decisions. We now work with hundreds of health systems across the country, arming community health workers and care managers with the tools that they need in order to be able to connect patients with resources at scale and really begin to change health outcomes for the patient population within that health system.
We don't limit ourselves to what happens inside of the four walls of Kaiser Permanente. We look at the total community and ecosystem around them. We're catching things upstream as opposed to waiting until you show up in my ER or in my doctor's office, and by then we're trying to recover you to go back to the healthy life.
Yeah. Our work is to repurpose the assets of healthcare, data, technology, workforces, infrastructure, through the lens of health rather than disease.